Hello, and thank you for joining me. My name is Dr. Abraham, and I am a practicing allergist located in Rochester Hills, Michigan. It is my pleasure to share with you some key highlights from our expert-led presentation on TEZSPIRE, tezepelumab-ekko, the first and only biologic approved for severe asthma without phenotypic or biomarker limitations. TEZSPIRE is indicated for the add-on maintenance treatment of both adult and pediatric patients aged 12 years and older with severe asthma. It's important to note that TEZSPIRE is not indicated for the relief of acute bronchospasm or status asthmaticus. TEZSPIRE is contraindicated in patients with a known hypersensitivity to tezepelumab or its excipients. Reactions, for example, rash, allergic conjunctivitis, can occur after administration of TEZSPIRE. These generally occur within hours of administration, but can have a delayed onset. Consider the benefits and risks. Stay tuned for additional important safety information. TEZSPIRE is the first and only biologic to target and block thymic stromal lymphopoietin, or TSLP, at the top of the inflammatory cascade. By blocking TSLP in this manner, TEZSPIRE reduces the release of downstream mediators. This impacts two hallmarks of asthma: airway inflammation and airway hyperresponsiveness. The mechanism of action and the clinical significance of this outcome and its impact on asthma have not been established. TEZSPIRE helps reduce biomarkers associated with airway inflammation. In the Navigator trial, which was conducted over a 52-week duration, the impact of TEZSPIRE on key inflammatory biomarkers was evaluated in a broad all-comer population of patients with severe asthma. The phrase broad all-comer population is important to note, as patients within the Navigator study were enrolled regardless of their biomarker status at baseline. A reduction in blood eosinophils and exhaled nitric oxide was observed as early as week 2 that was sustained throughout the duration of the study. In addition, TEZSPIRE resulted in a slow but progressive reduction in serum total IgE concentration throughout that same time frame as well. These results are descriptive only. TEZSPIRE has also been shown to impact tissue eosinophils. In the Cascade study, approximately 100 patients with moderate to severe asthma underwent bronchoscopy and biopsy after receiving either TEZSPIRE or placebo for up to 52 weeks. Treatment with TEZSPIRE showed an 89% reduction in airway submucosal eosinophils versus a 25% reduction in placebo-treated patients. These results are descriptive only. The assessment of airway hyperresponsiveness, or AHR, was also an exploratory outcome in the Cascade study. The figure shows the change in cumulative dose of inhaled mannitol required to result in a 15% reduction in FEV1, otherwise known as the PD15. Airway hyperresponsiveness, as measured by response to mannitol, was reduced in patients treated with TEZSPIRE versus placebo, with the end of treatment mean change from baseline being 197.4 milligrams with TEZSPIRE versus 58.6 milligrams with placebo, indicating a reduction in AHR with TEZSPIRE. The data from this study shows that TEZSPIRE had an impact on two hallmarks of asthma: airway inflammation and airway hyperresponsiveness. As a reminder, these results are descriptive only. Blocking TSLP with TEZSPIRE reduces a broad spectrum of biomarkers and cytokines associated with inflammation, including blood eosinophils, airway submucosal eosinophils, IgE, FeNO, IL-5, and IL-13. The mechanism of action in asthma has not been definitively established. In a clinical trial program of over 1,600 patients with severe asthma, TEZSPIRE reduced asthma exacerbations by 71% versus placebo in a broad all-comer population in the Pathway study, and reduced exacerbations by 56% versus placebo in the Navigator study. Additionally, a 79% reduction in exacerbations requiring ED visits, urgent care visits, or hospitalizations was observed. These results are descriptive only. Adverse reactions that occurred with TEZSPIRE at an incidence greater than or equal to 3% and were more common in TEZSPIRE-treated patients versus placebo-treated patients included pharyngitis, arthralgia, and back pain. It is important to know that TEZSPIRE should not be used to treat acute asthma symptoms, acute exacerbations, acute bronchospasm, or status asthmaticus. Do not abruptly discontinue corticosteroids. Dose reductions, if appropriate, should be gradual and may be associated with withdrawal symptoms and/or unmask previously controlled conditions. Treat patients with pre-existing helminth infections before starting TEZSPIRE. If patients become infected while receiving TEZSPIRE and do not respond to anti-helminth treatment, discontinue TEZSPIRE until the infection resolves. Avoid the use of live attenuated vaccines. The most common adverse reactions include pharyngitis, arthralgia, and back pain. So, I have just covered key highlights from our expert-led presentation about TEZSPIRE, the first biologic indicated for severe asthma that targets and blocks TSLP at the epithelium. I hope this information is helpful to you when thinking about a treatment plan for your next patient with severe asthma. The full prescribing information, including patient information, is available at tezspirehcp.com, or you can call 1-800-236-9933. Visit tezspirehcp.com to learn more today.